Bismillah ar-Rahman ar-Rahim. Today we will continue our discussion about the leg in the second session. Facial compartments of the leg. The fascia of the leg surrounding the leg and is continuous above with the fascia of the thigh or the fascia lata. Below the tibial condyle, this fascia will attach to the periosteum on the anterior and the medial borders of the tibia. Two intermuscular septa pass from its deep aspect to be attached to the fibula. These together with the interosseous membrane will divide the leg into three compartments: anterior compartment or the extensor compartment of the leg, lateral compartment, and the posterior compartment or the flexor compartment of the leg. Each compartment have its own muscle, blood supply, and nerve supply. Interosseous membrane. It is a membrane which binds the tibia and fibula together and provide an attachment for neighboring muscles of the ankle. The retinacula are thickenings of the deep fascia that keep the long tendon around the ankle joint in position and act as pulleys. Retinacula are the following types. First, extensor retinacula, which are two types. One is superior extensor retinaculum, the other is inferior extensor retinaculum. Superior extensor retinaculum is attached to the distal end of the anterior border of the fibula and tibia. The inferior extensor retinaculum is Y-shaped band located in front of ankle joint. You can see this is the superior extensor retinaculum, and this is the inferior extensor retinaculum. You can see that the inferior one is Y-shaped. Second type of retinacula called flexor retinaculum, which extend from the medial malleolus downward, backward to be attached to the medial surface of calcaneum. And the third type of the retinacula is called peroneal retinaculum. Peroneal retinacula, which are the superior peroneal retinaculum, which connect the lateral malleolus to the lateral surface of the calcaneum, and the inferior peroneal retinaculum, which bind the tendon of the peroneus longus and brevis muscle to the lateral side of calcaneum. And here you can see the flexor retinaculum on medial side of the ankle joint, and here you can see peroneal retinaculum, which are the superior peroneal retinaculum, and inferior peroneal retinaculum on the lateral aspect of the ankle joint. Now we are moving to discuss the front of the leg. Skin. Skin of the front of the leg is supplied by the following nerves. First, lateral cutaneous nerve of calf, which is a branch of common peroneal nerve, and from its name it supplies the skin over the upper part of the lateral surface of the leg. Second nerve is the superficial peroneal nerve, which is a branch of common peroneal nerve, supplies the skin over the lower part of anterior and lateral surface of the leg. Third is the saphenous nerve, which is a branch of femoral nerve, supplies the skin on the anterior and medial surface of the leg. Superficial veins in the anterior leg. Numerous small veins curve around the medial aspect of the leg, and finally they will drain into the great saphenous vein. Lymphatic vessels. Greater part of the lymph from skin and superficial fascia in front of leg drains up and medially in vessels that follows the great saphenous vein. Finally, it will end in the vertical group of superficial inguinal lymph node. Content of the anterior facial compartment of the leg. First, we have the muscles. Muscles in the anterior facial compartment of the leg are the following muscles. First, tibialis anterior muscle. Second, extensor digitorum longus muscle. Third, peroneus tertius muscle. Fourth, extensor hallucis longus muscle. Blood supply from anterior tibial artery, nerve supply from deep peroneal nerve. An important note about the muscles of the anterior leg: these group of muscles are long muscle with origin taken from the anterior surface of the bones of the leg. Their insertions, they are inserted into the foot, into the toes of the foot and the tarsal bones of the foot. Second things, all these four muscles share common action. They are extensor for the foot. Third, all these muscles are supplied by one nerve, which is deep peroneal nerve. Artery of the anterior facial compartment of the leg. The anterior tibial artery, which is a smaller part of the terminal branches of the popliteal artery, and it arises at the level of the lower border of the popliteus muscle and passes forward into the anterior compartment of the leg through an opening in the upper part of interosseous membrane, and it descends on the anterior surface of interosseous membrane. It accompanied by deep peroneal nerve. In the upper part of its course, it lies deep beneath the muscles of the compartment. In the lower part of its course, it lies superficial in front of the lower end of the tibia, having passed behind the superior extensor retinaculum. It has the tendon of the extensor hallucis longus muscle on its medial side and the deep peroneal nerve and tendon of extensor digitorum longus on its lateral side. It is here that its pulsation can easily be felt in a living subject, in front of the leg, in front of the ankle joint. The artery becomes dorsalis pedis artery. You can see here, this is the anterior tibial artery, which descends downward. In its upper part, it lies deep to the muscles of the anterior facial compartment of the leg. in its lower part it will become superficial, especially in front of the ankle joint, and here nerve on its lateral side, and here in front of the ankle joint it is superficial. Its pulsation can be easily be felt. And here you can see another figure for the anterior tibial artery as it passes in front of the ankle joint, and where it becomes superficial, easily palpated through the skin. Nerve supply of the anterior facial compartment of the leg is the peroneal nerve. This is one of the terminal branches of the common peroneal nerve, and it rises in the substance of the peroneus longus muscle on the lateral side of the neck of the fibula. The nerve enters the anterior compartment of the leg by piercing anterior facial septum, and then it descends deep to the extensor digitorum longus muscle, first lying lateral, then anterior, and finally lateral to the anterior tibial artery. The nerve passes behind the extensor retinaculum. Branches of the deep peroneal nerve, usually they are muscular branches to the anterior, to the tibialis anterior muscle, to the extensor digitorum longus muscle, to the peroneus tertius muscle, and to the extensor hallucis longus muscle. Second compartment of the leg is the lateral facial compartment of the leg. It composed of two muscles, peroneus longus muscle and peroneus brevis muscle. Its blood supply is coming from branches of the peroneal artery. Its nerve supply is coming from superficial peroneal nerve. Here you can see the muscle of the lateral facial compartment. An important note: the muscles of the lateral facial compartment are long muscle, large muscles. They get their origin from the lateral surface of the fibula for the peroneus longus from its upper part, and peroneus brevis from the lower part of the lateral surface of the fibula. Both of these two muscles, they have a long tendon, passes behind the lateral malleolus of the fibula, and the peroneus brevis muscle, it's inserted into the fifth metatarsal bone, to the base of the fifth metatarsal bone, whereas the tendon of the tibia of the peroneus longus muscle, it will move along the inferior surface of the foot from lateral side to the medial side to be attached finally into the inferior surface of the medial cuneiform bone and to the inferior surface of the first metatarsal bone. And this arrangement for the peroneus longus muscle tendon for its insertion into the foot is very important for its action, as it acts on the foot for eversion of the foot. Eversion of the foot, it means that the inferior surface of the foot will face laterally, and this movement is done by the peroneus longus muscle, and it occurs at a joint called subtalar subtalar joint. Subtalar joint. Artery of the lateral facial compartment of the leg. Numerous branches coming to the lateral facial compartment of the leg from peroneal artery, which lies in the posterior compartment of the leg, and it pierces the posterior facial septum and supplies the peroneal muscles. Nerve of the lateral facial compartment of the leg is superficial peroneal nerve, which is one of the terminal branches of the common peroneal nerve, and it arises in the substance of the peroneus longus muscle on the lateral side of the neck of the fibula. It descends between the peroneus longus and peroneus brevis muscle, and in the lower part of the leg it becomes cutaneous nerve or sensory nerve. Branches of the superficial peroneal nerve. You should know that the superficial peroneal nerve is mainly cutaneous nerve or sensory nerve, but it have a few motor fibers which supplies muscles and the lateral facial compartment of the leg. So it gives muscular branches to the peroneus longus and peroneus brevis muscle. Otherwise, it is mainly a cutaneous nerve or a sensory nerve. Medial and lateral cutaneous branches, they are distributed to the skin on the lower part of the front of the leg, dorsum of the foot, supplying the anterolateral surface of the leg and most of the dorsum of the foot. In addition, branches supplies dorsal surface of the skin of all toes except the adjacent side of the first and second toes and the lateral side of the little toe. Thank you.